Hi everyone, thanks for joining today's ClinicTracker community training series. My name is Alicia and I'll be walking you through today's topic, which is submission of claims and the resubmission tool. So today we're going to be specifically focusing on a new feature that we've added into the system that's really useful when we're resubmitting claims. Okay, so first we'll take you through setting up your original claim submission rules, but then we'll talk about how to set up some resubmission rules that help you automate that process. Okay, these tools are really helpful if you get a lot of perhaps denials or rejections from an insurance company where you need to actually resubmit a claim rather than, submit like a corrected claim or avoided claim rather than just simply submitting an original claim again. Okay. Before we get into today's topic, I like to remind everybody why we have these webinars. We want to make sure that you have frequent access to product experts like myself so that we can help you make the most out of our ClinicTracker and BillingTracker systems. Okay, we want to make sure that you can come on and ask questions about the topic that we have scheduled. And also we open the floor at the end of the session so that you can ask any system-related questions, any ClinicTracker or BillingTracker related questions here. Okay, during these webinars, we hope that you ask a lot of questions. Okay, so as we're going through, please use our questions panel on the GoToMeeting box. There's also a hand option, so you can raise your hand if you'd like to unmute your microphone and just speak your question out loud. Okay, if you have a question, please don't wait until the end. Just go ahead and let us know as we're going through. That's really helpful to make sure everybody gets the information they need. We do record these webinars, so you're going to be able to refer back to them later. If you're ever looking for a webinar recording that you can't find, you can just let us know and the support team will be happy to point you in the right direction. Okay, keep an eye on our upcoming webinar schedule. We keep that updated quite frequently, and we're constantly adding more, so please do keep an eye on that. We'll alert you through those in-app notifications that you've been seeing. You can also submit your webinar suggestions through a support ticket right at the top right-hand side of your screen. Okay. Okay, with all that being said, we'll jump into today's topic. I can't stress enough that your questions are really helpful to me, so please don't hesitate to ask them as we go through. We definitely want to hear from you. Okay, so we'll jump in and we're going to go right over into BillingTracker. Okay, BillingTracker is the system where the claims are kept and we can reconcile balances. We submit claims from here. Okay, before we can do very much in BillingTracker, we need to go through the settings menu here. Okay, so everybody should see the settings menu. Okay, and many of these settings are covered in our BillingTracker administrative training webinar. So if you missed that or you want us to get it back on the schedule for a new round of it, please let us know. We're happy to send you the recording and also schedule another one if the group needs one. You can also let us know through the questions panel that you do want to see that on the schedule or you need the recording, and I'll make sure we follow up. Okay, the specific setting that we want to focus on today is this insurer plans. Okay, we need to set up our insurer plans for each of our payers. Okay, so even though this says insurer plan, it could be a grant payer or an EAP payer. Okay, so I'm going to click here. Okay, and with this insurance box open, I see my insurers that I've entered on the ClinicTracker side. Okay, these insurers were entered by going into the utilities maintenance menu. Okay, and if you missed that training, that's the ClinicTracker admin training. We can send you a recording of that webinar if you need it, or if you need that back on the schedule, you can let us know. Okay, I'm double clicking here on the insurer, and you can see that I have the general tab open here. Okay, so lots of stuff in here for the insurance company that we need for our original submission. Okay, so just walking through very simple things. We need things like the name, the address. Okay, usually here we need a 9-digit zip code. Okay, so although I have a 5-digit zip code, that could fail and be rejected. So you usually want a 9-digit zip code in here. You see that we have some other information. Usually I see this being left blank, but it may pertain to you, so that's up to your billers. Okay, down here, the plan type. This is going to be a really important setting if you have things like Medicare or Medicaid, okay, even CHAMFA. So you want to pay attention to the plan type. This is going to make sure that we include the right information within the claim. There are certain pieces of information that these plan types require. And if it's not listed here specifically, you're just going to choose other. Okay. Anybody has questions there, let me know. Okay, the notes here, this is for you. Okay. Okay, we have options down here at the bottom, like don't transition to BillingTracker. So if you have a grant and you just want to generate a report, you don't want to make claims for that, you could say don't transition these to BillingTracker. Okay, and we could even hide this payer from the patient portal registration, meaning we don't let people kind of select it when they self-register through your patient portal. Okay, next tab, plan requirements. Okay, on the plan requirements tab, excuse me, this is where we can set up what we call our pre-transition checks. So just to kind of summarize what that means for you, pre-transition checks is where the system will check the appointment record, the demographics record, and it will make sure that it has all of the necessary information before the system will even create a claim. And if something is missing based on what you've set up here, it's going to alert you and say, I can't create a claim right now because it's missing, for example, the authorization code. This is a really helpful feature because we want to make sure your original submission of the claim is as correct as possible. So many of you billers know that if we submit something incorrectly, it's going to perhaps be denied or rejected, and that's just going to take longer for us to get paid. So we don't want to do that. These pre-transition checks help us make sure the claim includes all of the information before it's even created. Okay, so things like require date of birth. Now, most of these are very self-explanatory and you can mouse over, but there's a couple that I want to point out. Okay, so you can see what I mean by mouse over as I kind of hover my mouse there. You can see that a little description pops in. That just helps me understand what the setting is for. If anybody has questions, let me know. Okay, one of the options I do want to point out to you is this provider level credentialing. So if you're a clinic who has contracts with a certain payer and you need each clinician to be specifically credentialed with that payer, you want to make sure that you check this box. It's going to prevent the scheduling team or the patient portal or the find available appointment feature from using this provider if they're not credentialed, right? So if I tried to schedule an appointment for Heather West with Blue Cross Blue Shield, the system just wouldn't let me do it because Heather is not credentialed for this provider. Okay, if anybody has questions on that, let me know. Okay, another feature I like to point out is this paper claim if not primary. Okay, so a lot of times Medicaid needs to go as a CMS 1500 or a UB04 if it's not the primary as opposed to an electronic claim. So if it's a secondary claim, I need to basically drop it to paper is what it's called. Okay, any questions on the plan requirements tab? Okay, we got in here by going into BillingTracker, settings, insurer plans. I double clicked Blue Cross Blue Shield. We talked about the general settings and the pre-transition checks. Okay, next we'll talk about claim details. And right at the top here is really what's critical. We need to tell the system what type of claim this insurance company is sending out. Okay, so claim format. In our case, we're going to focus on electronic claims. Okay, which means I'm going to go right over to eClaim options. I'm going to focus on the options there for those original claim submissions. Before I go over, I just want to mention, if I do have to drop to paper, if it's secondary, I need to fill out the paper claim options as well, okay, because the system needs to know how you want those paper claims to be going out. Okay, so to that end, you have the CMS 1500 settings right here and the UB04 options here. Anybody have questions there? Okay, going back up to the top, we talked about the claim format. If you are using a paper claim UB04, or otherwise known as an institutional paper claim, you do need to have a UB04 configuration set up. That's right here. You can set those up by going to settings and then UB04 configuration, okay, right under that settings menu. The default bill type configuration, if you don't change this, it's going to go out as a 0, okay? So billers are typically familiar with what this means, but just to explain, this value basically tells the insurance company or the payer what kind of claim is it. Is it an original claim, which is typically what we use for what's called professional claims, which is what most of you send. If it's an institutional claim, you might send admission through discharge on your original claim submissions. Okay, keep in mind later on when we do resubmissions, we may need to send a 7 or 8. Okay, so if you don't choose anything here, the system's going to send out a 0. Okay, by default. You can overwrite this on each claim. Okay, paper claim type default, just to explain what this means, you have options here, process with or without background. That means if you want the paper CMS 1500 template to print out, you'll need it with the background. If you have paper CMS 1500 paper in your printer and you're just printing onto that already created template, you're going to process without background. Okay, does anybody have questions on the claim details tab? Okay, lots of settings in here. A lot of them are pretty self-explanatory, like set box 24J. Okay, you can see the mouse overs, but we're happy to answer questions if you have them. Okay, electronic claim options. This is where I can set up the type of, the transmission type. So this is going out as an electronic claim, but I need to tell the system where is it going. So by default, you're going to have a TriZetto professional claim type setup for the transmission type. Okay, you can set up additional ones by clicking this button. Okay. If you have questions about setting up your own clearinghouse, like if you don't use TriZetto, you want to submit directly to an insurance company or through a different clearinghouse, that's all fine. You need to get what's called a companion guide from that place. So TriZetto publishes a companion guide that tells me what I need in each of these areas. So you can see as I mouse over, it says this little kind of number in there like ISA 06 and ISA 02. When I search the companion guide, I'll find those values and it will tell me what I need to put in each of those. Okay, but if you have any questions, you can work with your implementation specialist, give them your companion guide, and we're happy to help. Okay, next, this NAIC number, this is really important, okay, especially if you're sending to a clearinghouse. This is the payer ID number, okay, and that comes from the clearinghouse. You need to look at their payer list. So TriZetto publishes a payer list that we reference, and that's where this ID came from. Okay, you can see that I have a space for institutional and professional. So if you need to send both types of claims, make sure you put both payer IDs in here. Okay, I'm going to skip down to the NM109 priority. These again are very important. These determine what NPIs and like address, agency names are going out on the claims. So some clinics are credentialed, if you're a smaller clinic, you may be credentialed under your supervising provider and all claims need to go out under her name, for example. So in that case, you would say billing provider equals provider. Okay, and if you're thinking of a CMS 1500, if you think about the bottom where it has those boxes for the billing provider, rendering provider, etc. This is what we're filling in here. So we have options like provider, we have appointment location MPI, and main building MPI. Okay, so we're going to say it's the appointment location MPI. So most agencies that aren't smaller use the building or the agency NPI in the billing provider area. And then in the rendering provider area, we use provider. Typically. Okay, you're going to need to refer to your specific contracts to see what you need to put in each of these areas. Okay, coming down here, you can see that we have some additional values. Again, these go back to those payer companion guides. Okay, we've set up what we typically see, so you can usually just leave those alone for your initial tests, and then we can adjust if you get a rejection on your initial test. Okay, if anybody has questions on that, let me know. I don't see hands up and I don't see questions, so I'm going to keep moving. But please do, jump in if you have anything. Okay, e-claim options 2. you can see that I have a number of options in here. Again, they're all pretty self-explanatory, so I'm not going to spend a lot of time here. I just want to mention these mouse overs. I'm just hovering over, and it gives me more information. Okay, and again, we've set these up with our standards, what we see most often, but typically when we're testing, you may get a rejection and we need to come in here and adjust something. That's totally normal. Don't be alarmed by that. Next, secondary claims. We have some secondary claim options for coordination of benefits. So if this initial claim is going out to the secondary payer, we probably need to send what the primary payer had returned. So again, we've set up what we normally see here, but you may need to make adjustments. Again, typically we're learning that through the test process. You submit a claim, and then if they reject it or deny it, we can make an adjustment here. So as you're kind of starting, we recommend you send maybe 1 or 2 secondary claims so that we can make sure we get the settings right before we send hundreds of secondary claims. If anybody has questions, let me know. Okay, you can see here at the bottom, if you need to override the original payer ID, maybe there's a secondary payer ID, you can override that here. Okay, next, my favorite new tool of Billing Tracker. I'm very excited to share this with you. It has saved my team on the billing service so much time. My friends over there say that it is one of their favorite new features as well. Okay, so this resubmission setting is actually going to allow us some automations when we're posting payments in the ERA, and I'm going to show you that in a few minutes. Okay, so with these settings, I can say enable resubmission, and that's going to mean that I can use these automations. Excuse me. So here I'm overwriting the bill type frequency for a resubmitted claim. So this is going to be used, let's say I get a denial code from the payer. And in my example, I'll say it's missing an authorization code. I didn't realize I needed an authorization code. I sent it out without one. I got a retroactive off, and now I need to resubmit the claim with that off. Okay. I typically will need to change the bill type frequency. So if you remember back on the claim details, I mentioned you need to say it's either original or admission through discharge, typically speaking, for our purposes. Okay, that tells the insurance company what type of claim it is. When you're resubmitting, you need to tell them it's either an adjustment or a void to that prior claim that you had submitted. Okay. Then you can set the substatus. So these substatuses are actually configured by you in the settings menu. Okay, and we've given you what we use by default over in our billing service. Okay, so we might say we're disputing a denial code. Okay, next I could say the local use. So typically I need to put in a local use note on my corrected claim, and I can indicate the note type, which is additional information. Okay, next, I need to tell the system, what if I resubmitted this claim before and I have an original claim number from the payer that's already on the claim? Does this payer require the original claim number from the payer, or does it want the newly returned claim number each time? Okay, so if it just wants the original, you're going to leave this box unchecked, but if you need to overwrite it with the new claim number that's returned each time, you'll check this off. Okay, include remark codes. In some cases, perhaps Medicare, you need to include your remark codes if you are resubmitting a claim. So you need to say why it was denied in the first place. So you can check that off. Okay, the claim override type, if you need to resubmit electronically, that's great. If you need to drop to paper, you can do that as well. We'll say electronic. Okay, the next payer balance. So basically, because you're not going to apply this adjustment, or there's a balance left on the claim from this adjustment, we need to tell the system, where do you want to put that balance? So typically speaking, we want to keep it on this current payer because we're resubmitting the claim. Okay, we don't want to move it to the next payer, but if you do need to use the next payer, you can do that as well. Okay, the note type. The billing notes are a really good feature. If you haven't seen our webinar about the billing note dashboard, I highly recommend that you take a look at it. But this is how you can track your follow-up follow-up activities in Billing Tracker. Okay, so again, under the settings area, you can set up billing note types. You can see I have quite a few. So I might set up one that says resubmitted. Okay, and that might generate a task in 5 days or 10 days to follow up on the payer portal to check the status. Okay. Finally, at the very bottom, once I get one payer set up, if it's similar from payer to payer, I can just copy them from the first payer I set up by clicking this load from selected insurer. Right, does anybody have questions on this? Okay, Yvonne, I see you have a question. I'll unmute you. Hi, Yvonne. I've unmuted you, Yvonne. I'm not sure if you can.
Oh,
unmute.
there we go. All right,
Okay.
sorry. In that short amount of time, I think I've just, between raising my hand and now, which was just a couple seconds, I think I might have forgotten my question already.
Okay.
Let's see. So when we are posting our ERA, like currently what I do is I just open up claim details and I do all of this.
Right. For each
And
and every one.
yeah, because it's by line item, right? It's by little individual claim. So I
Mm-hmm.
do this. However, for one of our payers, they require a modifier be added to the CPT code, which we add. By doing this, I mean, like, how would I initiate? Like, I already do it through claim details. So can you tell me how this is
Mm-hmm.
different and how this gets initiated? Is it that I wouldn't have to go and choose bill frequency type and in dispute and all of that? Is that what this is for?
Yes, exactly. So in a few minutes on the ERA, I'll show you how these are actually applied across multiple claims at once. So you're not having to go into each individual claim and click through all of these things.
Oh, yeah. And see, that's just, okay. So that's the way I just do it when I'm posting it. Like when I'm working that claim line item, I'll just
Mm-hmm.
do it right then.
Right.
I don't save up to do a bunch of them at a time because then that leaves room to maybe forget one or something.
Yeah, so I'll show you, I
Okay.
mean, even though you might not want to do multiple at once, you could do one at a time. Even though you're doing one at a time, this automation just saves you all these clicks and what if you
Okay.
misclick and then if you have to train somebody else, etc.
Okay, great. Oh, that's great. Yeah, because it does take a bit of a time and having it
Yeah,
automated is helpful. All right, thank you.
yeah. And with that modifier, Yvonne, if you could send in your example through a support ticket, that might be something we could even add in here.
Okay, yeah, that'd be great. Yeah, they just require modifier CC to indicate to them that it's a corrected claim and and attach it to the CPT code.
Great. Okay, yeah. So we'll
I'll
take
send
a
a
look
ticket.
at adding. Yeah, that's great. We can take a look at adding that in for you. But if anybody else has stuff like that, oh, I have to also do this, like Yvonne's example is the modifier. We don't know that unless you tell us. So just like Yvonne told us, we're able to action that for you, Yvonne. Is there anything else you can think of?
No, just that, in the note types, there's so many different pieces of information. I'm not note type. Yeah, note type. There's so many different scenarios that I'm thinking that that would not necessarily be automated
Sure.
unless you're doing a bunch that are the same reason, right?
Yeah, so I mean, and that might actually be the case. So you may actually have note types for like CO45 and CO109, for example.
Yeah, diagnosis issues,
Sure.
unit issues, whatever. Yeah.
Yep,
Okay.
exactly. Yep.
Okay.
Okay.
Thank you.
So absolutely. So I'll go ahead and mute your microphone. Of course, raise your hand if you need to. Again, happy to answer any questions. Okay. Okay. Diane, I hear your request. I'll definitely try to slow down a little bit. And yes, I'll go over submitting and submitting some claims actually right now. Okay. So I just want to pause for a moment. We kind of talked about these insurer plan options. The new exciting feature for me is this resubmission settings. It really has saved my team a ton of time, which I'm excited about. And just like Yvonne had that example of adding in the modifier rule, if you guys have anything else like that we could add in for you to make sure that we're saving you time, ensuring accuracy, making sure we can delegate things to new hires without a ton of training and worrying about them misclicking, let us know what we can put in here. Okay, so again, bill type frequency, we talked about the sub status. These are things you add in. Local use, this is something on the claim, same with note type. Okay, the ICN, that's the original claim number that the insurance company gave back to you. So one way to think of it is the insurance claim number. Okay, and so the original one is the first one that comes back, but let's say I get another denial and I have to resubmit again. Shoot, I forgot to add in my my authorization number, whatever the case might be. Do I need to send the original claim number that the insurance company sent back? Or does it need to be the new one that came back with this new denial? Okay, so if it needs to be the new one, click overwrite. Okay, we talked about the remark codes. So remark codes come back on your ERA. They explain about the denial. We can include those on the resubmission. Okay, so again, I'm just pausing. I don't see any additional questions coming in. So I'm going to close out of here and we'll go ahead and we'll transition an appointment, submit the batch, and then we'll look at the ERA and resubmit. Okay. If anybody has questions, please do raise your hand. Okay, I'm coming over to transition appointments. Okay, you can see that we've actually added in a lot of automations for you. So if you just want to auto transition the last 365 days based on your transition settings that you've set up in your billing tracker options form, you can do that. For our example, we'll manually transition using that top option. And you can see I have a claim to transition here. I'm going to I'm going to click it and click transition selected. Okay, it lets me know that the transition succeeded. Okay, that means it passed all those pre-transition checks we talked about on that insurance plan requirements tab. Okay, I'm not going to view the log for this example. I'm just going to move on to submitting the batch. I'm coming down to claim management. Okay, I need to look at queued claims. Queued claims are going to include anything that has just been created or anything that I've corrected and it now queued up to go back out. Okay, in our case, we'll process electronic claims. I want to look at anything that I queued up today, but if you wanted to go back a week or so, you could adjust this date range. Okay. Here where it says payer, you'll notice that everything is selected. It's highlighted in gray, but if I just want to process Medicaid, I can click there and now it's turning blue. It's letting me know I've selected something specific. I can right click and select all again. Same with location. And then finally, transmission type. Remember, these are, where are the claims going to go? So in our case, we want to look at professional electronic transmission type to TriZetto. And then once I've set all this up, I can click display claims. Okay, here's everything that I have ready to go out to the insurance company. So I'm going to use my shift key. I'm going to click on both the claims. You'll notice I can also, right click and do things like add a billing note from here. So if I wanted to say I created a batch or something like that, for now I'm just going to highlight and click process. Okay, it's saying, do you want to process everything? I'm going to say yes. Okay, we're going to scan the batch that was just created. Okay, a batch is like a file that the computer creates that contains many claims. So we call that a batch file. It's letting us know that we had some problems in our batch, like a missing NPI or a missing license. For today's example, I'm going to pretend it was all fine and we'll submit the claim. Okay, and we're going to come here to FTP. The reason I'm using the FTP button is because I have a clearinghouse that allows me to submit files directly through this kind of computer connection. It's called file transfer protocol, in case anybody's curious. Okay, if I click there, I can click connect. Once it's connected, you'll click, and you can see I'm not going to actually be able to connect because I don't have a real account. Once it's connected, you'll see this remote machine area fill in, and you'll click the upload button. Okay, you see an error like this one on screen, it just means that your account username and password is incorrect or something's misconfigured. Go ahead and reach out to support. We're happy to help. Okay, once you do connect, you can click that upload button and then simply disconnect. Okay, that's going to put the claims where they need to be on the clearinghouse file. Okay, if you don't have an FTP, you can click the web button. That's going to open up the insurer portal or the clearinghouse portal where you can then manually submit the batch. When you're all done, you can indicate the submission status. So let's say I looked at this and I said, this is not going to be submitted because it's incorrect. I could update the status there. In our case, we're going to pretend we did submit it. So I'll click update. Okay, this is where I might go in and add my billing note and say, okay, this claim was submitted to the clearinghouse. And that just fills in all this information. I could say it was batch number 57. I can see that over here. And then you can see the follow-up required is filled in for me. That's based on how I set up my billing notes. Again, that's under settings and then billing note setup. Okay, I'll just save here. That saved all those notes across the claims. So if you had 25 claims, it would have made 25 billing notes. They'll all have follow-up required. Okay, and then your team can work those tasks all at once. Okay. Let's say we receive those payments and we're gonna now go into the ERA. So the remittance came back for the claims we just submitted. Now I am gonna look at my unapplied entries. Okay, and now we'll say this claim right here, we'll just pretend it denied for a missing authorization code. This is where I could go in and add in the authorization code. Oops. Sorry. I'm just going to do that by clicking the CD button here. Okay, and that's where I can come in and enter in the authorization. So, you know, like I can say that was wrong, so it needs to be 1, 2, 3, 4, 5. Update. Now this is where Yvonne was saying, now this is where I typically go through and click all those buttons since I'm in there. Instead of doing that, what I can do now is just resubmit. So I can just click this and use the correct resubmit. That goes through, it adds all of that information that I configured to that claim, and it applied that payment for me, or that line for me, I should say. Okay, so we're just gonna go in to the billing account and we'll view the claim and we'll see what happened. Okay, so now I can see the bill type frequency was adjusted. This reference control number, ICN, came in from that file, the payer control number. So I didn't have to copy and paste it or manually like write it down and bring it in. The system did it for me. I didn't even have to right click and say, send a claim. Okay, if there were remark codes, they would have been entered here. Okay. There is a question about appeals in the claims. So that really depends on if you need to send additional information. So typically you're needing to drop those appeals to paper. So you can set up your resubmission rules to drop to paper and then include the additional information that you want to have with the appeal. Please let me know if that answers your question. Okay, so does everybody kind of see how to submit the claims, how we set up the insurance company specific requirements for those claim submissions, and then how we automated the resubmission process a little bit. Okay, now that we've corrected that claim and we've applied the balance to that current payer, you can see that the balance is queued right back up to go back out. So if I were to go back to the claim management screen, like I do every day, and process my electronic claims, that corrected claim is going to be queued and ready to go out. Does anybody have questions on what we've gone through? Okay, I'm going to pause for a minute. I know people are taking notes. I'm happy to cover anything that you need me to go through again. We do have some time left. So if anybody needs me to go through anything again, please let me know. Or if you have specific scenarios you want to see how to cover, let me know. You can also start thinking of your just general ClinicTracker billing tracker questions. We'll open the floor for those in just a moment. Since we do have a few minutes and we're waiting for people to kind of type in questions and catch up, I do want to mention under the settings menu, there is a lot. There's a lot to check out, and there's a lot that we referenced today. And we talk about a lot of these in the billing tracker, admin training. But if anybody has specific questions about how to accomplish something in billing tracker or your specific billing need, let me know. While I'm waiting for those, and Yvonne, I see yours, I'll unmute in just one second. I do want to mention this billing note type setup. This is what I was referring to before. This is how we manage our workflows in our billing service. So we do have, like appealed. And then, somebody has to follow up in 15 days. And that person is going to be me, etc. Okay. So I think, Kaylee, you're asking about the local use note for indicating to the clinician why you're resubmitting the claim. So the local use note probably wouldn't be used for that right here. It populates on the claim form. So you really don't want to put that in there. That's going to show to the insurance company on resubmission. Instead, you want to use that billing note. Okay, so over here, you can even manually enter them if you're not resubmitting, but this is where you can have different note types. And you could say, one that says resubmitted, and then this is where you could say it was resubmitted because. Let me know if that works for you, Kaylee. Okay. Awesome. Okay, and then Diane, the billing tracker admin training, we can have that link sent out to you, but we can also schedule another one. So, and we have some time today, so we can go through a few more of those rules, but we can definitely schedule a full billing tracker admin training in the very near future. Okay. Yvonne, I think we can go ahead and unmute you.
Thank you. Hi.
Sure.
Can we go back to payments? Could we?
Yeah.
Right there. Let's pull up a payment. So suppose I received a denial on this, or they paid incorrectly, right? So it's going to require further research. So typically what I do is then I will process this as a non-balance affecting payment, right? So that I can get that information loaded, but I'm saving it because I want to work on it later. And the only way I can keep it from queuing up to bill again, well, I can't even keep it from queuing up to bill again. That's the problem. So, but how I work around that is I'll place it on hold. And then when we transition claims, I retrained our person who transitions claims to exclude all claims that are on hold. But
Okay.
how can I apply a payment. So they've paid under their listed allowed amount. So I just want to get the payment applied. How can I prevent it from queuing up again? Because then that impacts our financial reports. So it looks like now we end up having double the amount billed, and we have no way to identify those claims that are resubmissions in our financial reports. So how do we keep it from queuing up again to the insurance when I don't want it to re-queue? I just want to post the payment and then leave it like that so that I can work on it and not have to go back and make sure it's not queuing to the insurance. Because if I forget to put it on hold, it ends up going to the insurance again through our automatic, through our transitioning process.
Sure. So is that kind of like a limited number, or is that like the majority that you wouldn't want to resubmit?
It's a limited number. So if we get a large payment, let's say a $17,000 payment, I might have 5 to 10 claims, or if it's for a particular code, I could have quite a few because they're consistently paying below the allowed amount for particular codes. And I, of course, write my billing notes, and I put it on hold, and I post them as non-balance. I do all of this work, right? But it still, ends up queuing a claim, and I want it to not queue a claim.
So in that case, you would need to, it sounds like, kind of manually just mark it as pending so that
Okay.
the generated transactions come out of queued. So what you can do is view the claim, so right click and then view claim. And then here where it says transaction, where this is
Yeah.
queue, I can just cancel
Yeah,
that
that
transaction.
I do that. Oh, you said cancel and not mark as, yeah. That's just an extra step. So there's like already
Yeah.
like so many, sometimes there's a ton of them on there, and I'm having to do all 5 of these steps, for each of the claims just to please make sure it doesn't get queued, And
Yeah.
again, like I said, it still impacts our financial. So that
Is it
I'll send a ticket later.
Is it per payer though? Is it like on the resubmission rules, I could add something that says mark transaction as pending?
Yeah, if there's something quick, because yeah, it could be any payer, right? It could be any payer that, what, we don't want to resubmit the claim at this time. I'm just only wanting to post this payment because this claim needs to be worked, at another time and figure out what's going on with it, what's happening, do we need a resubmission or is it a valid denial? There's all kinds of scenarios where we're not ready to send something in again. And like I said, it's impacting, like, is there some way, somehow, it can be treated like a courtesy claim to where it doesn't get, once we post that payment, it doesn't.
So I know that because you're saying it's not a general thing, it's not the majority of the claims that you would put on hold. Um,
But it's quite a
if
few, though.
Okay, sure, but if it were the majority, like I have settings that say all of the transactions would go into pending and none of them would go into queued, which I don't think would
No.
be ideal. So what might make sense is if we had some kind of bulk action like apply, and then mark as pending, right? So it's kind of like an override.
Yeah, where it could be done something quickly here, yes, and
Okay.
then, you know, pending for review, right? So it would
Yeah.
be, yeah, apply payment and mark pending for review or something like that. Because then when somebody pulls up the billing account, they can see that pending for review even and know what's going on just at a quick glance.
Sure. Yeah, that's a great idea. So I'll add that to the list of suggestions.
Okay. And then that could then in turn, if we can pull into our financial reports for it to capture that information, then when our financial reports are printed, we could see if it was a resubmission or not too.
Yeah. So, I mean, you're marking the transactions as pending without resubmitting. So we'll be able to see that it wasn't in a batch. So on your
Yeah.
financial reports, we could filter it that way.
Mhm.
Okay.
Great, thank you.
Absolutely. Anything else before I mute your mic again?
No, nothing. That was it.
Okay, great. Okay, so Sheila's asking about reports, so I'm going to move away from the ERA, but are there any questions about the ERA or processing here before I move on? Okay, reports. So Sheila's asking, is there a way to break out the denial codes by office? So for example, they have a lot of adjustment codes for a certain reason, and they want to see it by office. So under reports, you might look at the payments, and this is where you can look at payment applications. And you can even do it by like entering user. And this is where you might want to look at the adjustments. Okay, and then once you're in here, you're going to be able to just look at last. I'm in a demo, so I'm just going to. Okay. Oh, you know what? I was thinking that this one had place of service, so maybe that's not the best one. Let me look here. So Sheila, that might be a report builder item where we might have to ask your team to create something that's more specific to what you're looking at, because this is just going to show you across your agency. So I would say in your case, let's work together perhaps on your next group meeting on that report so we can make sure it's specific to your needs. Okay. Any other questions about submitting, resubmitting claims, reporting? Anybody have specific billing scenarios they need to make sure they have covered? Here to help. Okay, we do have a few more minutes. So I just want to, again, go back to the settings menu, take a very quick spin through it. Okay, at the bottom, I do recommend everybody take a look at their options form. Okay, there's a lot of settings in here. You'll notice the little eye icon that brings up a help link, so it gives you more information about each of these settings. Some really important ones are this like progress note upon transition. You can see I don't require a locked signed progress note before a claim is created. You may have been through an audit and have learned that you don't want to do that, so you block any claims from being created before that progress note is all locked and signed. Okay. There's also additional transition settings like, do I charge the client's card on file, or do I check their credit balance first? Okay. Claim handling settings like combining claims. So do I need to combine based on the authorization code or just the clinician? Okay. ERA settings. Here I can say, and do I even want to have the ERA? But you can see that there's lots of settings in here. So take a look through. Okay. There's also settings in here that allow us to automatically add modifiers. So this is another really useful tool. So modifier rules. Okay, again, these are all covered in that BT admin training we'll have. And we'll go through more specifically. These modifier rules allow us to automatically apply modifiers to certain CPT codes or for certain insurance companies, or if it's just a certain credential level, we can have those rules. Okay. We also have rules like if your billing clinician needs to be different. So one of my examples was all of the claims have to go over go out under our supervising providers MPI, regardless of who actually rendered the appointment. So this billing clinician override will help you with that. Okay, same with location overrides. Location type overrides, do I need to put in a 2 for telehealth? Okay, program-based MPIs, if you're doing PRP, maybe you have a different MPI based on your location. Okay, transmission type overrides, am I doing regular therapy and IOP where I have to send IOP as institutional? This is gonna help you. Okay, we also have things like configure your patient statements. We talked about the billing note type setup. I have alluded to this claim substatus. We've given you our common substatuses, but you could put in your own. This is another way you can tell your clinician, Kaylee, what the status of the claim is, and the clinician can easily see that. Okay. Any questions? Billing checker, ClinicTracker, any questions at all? Okay, I don't see hands up. Oh, I do see a hand up. Coyle, are you there?
Yeah, can you hear me now?
Yes.
Okay, so I feel like maybe I'm even a little bit behind all of this, but I'm just going to throw this out there
Sure,
since we
sure.
have a couple minutes. If a claim is paid incorrectly, how do we mark it as that for me to come back to do follow-up on? Like, say I have time next week that I'm going to come and do follow-up. I think that you were just going over that a little bit a minute ago, but I don't know how to get to that point if something comes in processed incorrectly, and then just hold on to it to do whatever I need to do. And then how do I find it to do that afterwards?
Sure. So, you know, let me show you this. So in here, what we had talked about with Yvonne is kind of adding something that said apply this payment, but
Right.
don't queue up the next item. So that's definitely one way, and that's the way Yvonne finds,
Right.
is useful to her. What our team might do is not apply the payment at all because we're questioning it. So we might hold that payment and mark it as erroneous with a comment. So I might say, I'm holding this because holding for follow-up, right? So I'm just going to put in a test comment and save. Okay. Now here I have that set up. My team would then just mark this as erroneous. And I say, I'm not going to apply this right now. Okay. To find it again up here where it says status, you'll see there's erroneous entries.
Okay.
And then I can come in and right here it says revert. So now I'm ready to work it.
Okay.
So, and I can throw everything back into unapplied that I want to work right now, and then go back and look at, just change my status over.
Okay.
Okay, does that work for you?
I have one other, I think it's a simple question.
Sure.
When I call to do claims follow-up, sometimes they list off the boxes that are filled out incorrectly or one that's left blank. In our current system, I can just pull up that claim and take a look and say, oh no, this is in there or whatever. Is there a way for us to actually see what the claim looks like that is submitted? Like the way that we would print one out or something like that?
So here on the billing accounts, I went to the billing checker main screen billing account. I highlighted a claim. And then on the transactions tab, here's my electronic claim. It's pending, I'm waiting. But now what I want to do is override the claim. Paper CMS 1500. Oh, sorry. Actually, instead of right clicking, use this. Let me just requeue. Is that right? Okay, so I've overwritten the claim format. So I right click, overwrite the claim format, paper CMS 1500. Then here what I can do is preview. without processing, and it brings it up on screen. Whoops.
Okay, all right. Sometimes just we need, because we're fairly small in
Sure.
comparison, I think, to maybe some of your clients. So sometimes it's just claim by claim. We need to break it down to just see, you know,
Yeah,
to kind of wrap our brain around the way these are submitted. Thank you.
sure thing. Let us know if you need anything else, okay?
Mhm.
Okay. I think we're approaching the time, but if anybody has additional questions, we have 5 minutes left. Happy to hang out and answer any questions that everybody has. Okay, but if there's nothing else, we'll go ahead and wrap up. We do have more webinars coming on the schedule. We are going to schedule another billing tracker admin, a full admin session. And then the recording will be posted on the user portal. So you can find those by going to the user portal. On the user portal, under the right-hand side, there is the ClinicTracker community training, or you can come right here to this one, ClinicTracker community training. And there's the previously recorded webinars. Okay, now if you have trouble finding it, and I apologize, my user portal is just loading a little bit slowly, but if you do have trouble finding a specific webinar link, you can actually just reach out to the support team and we're happy to point you in the right direction. Here we are. This is where you'll see our webinar schedule and then a link to our previously recorded webinars. Don't forget, if you do have topic requests, please do send them in. We're constantly adding topics based on your suggestion. Okay. All right, everybody, if you have any questions that we didn't cover today, please do send them in. If you have webinar suggestions, send them in, and we'll wrap up for today. Thank you, everybody, for joining and asking all these wonderful questions. I can't wait till the next webinar we can get back together and have some great engagement like we did today. Okay, I hope everybody has a great weekend, and we'll talk soon.